marriage could be described as abusive, but she held on despite the abuse. Many people will endure many things because of their children, especially in a society where there is no social support. And most of these societies are male dominated. Women endure to secure their children and themselves so as not to be thrown out of the house. In some cases, most of these women will have no other place to return to other than their parents' house. This is not right. Time changes. In the process, it changes us, as everything here is in a dynamic state. In the process, we wear and we tear, resulting sometimes to chronic illness. Some life choices could also be contributing factors, or an accident unexpectedly could happen and render one disabled for the rest of one's life. In such a situation, some couples could not handle it. They run away, abandoning their partner. Is it right? Where is the in sickness and in health love promise? Are there better ways to handle the situation? I remain your regular host, Nkoh. Angelina, as mentioned above, not real name though, found herself in such a situation. Her husband had a stroke. Despite years of abuse and neglect of the children, instead of abandoning the man at his most vulnerable time in life, Angelina swung into action. Her children were not happy. They encouraged her to leave, but she did not abandon the husband and their father. The bond must have been terrible because none of the children cared about his condition. Angelina took a course in stroke management, and today she is a qualified caregiver for stroke patients. She has more understanding and has been the source of support for her husband ever since. Cooking for him, bathing him, feeding him, working side by side with him and talking to him as if he could still respond. Angelina did not run away. Also, James quit his full-time job to take care of his wife who had cancer. For 2 years, James accompanied his wife to all appointments, taking care of her until the end. James did not abandon his wife. Unlike the likes of Angelina and James, there are others who will run. Why do they do it? Could it be the deprivation of their free time? Because sometimes taking care of people with chronic illness could be very demanding. If the sick person can still process information, some might show anger and sometimes other aggressive behavior, lashing out at the caregiver. And this could be difficult for untrained caregivers to handle. Some people go into depression seeing their loved ones in such a condition. To many, it signifies the end of what they know as a beautiful life. In some societies, the situation is slightly different. The caregivers might get paid for their services. The caregiver might stop working and the social security system will take over, providing some cushion for them. The burden of chronic illness becomes heavier when the spouses of the sick person are the primary caregivers. Research shows that such spouses are 6 times more likely to be depressed than their counterparts who are not the primary caregivers. Economy is a major source of concern too, which makes it essential that couples plan for their later age in life. So how can couples cope? Or how do they deal with the stress of a chronic illness? Communication is crucial. as agreed by many experts. However, some of these experts did not factor in other issues that might be going on with the patient and the other partner, which the caregiver has no expertise on. As well as communication, we will suggest openness at the outset so that the other partner, who is likely to be the caregiver, knows exactly what is going on. This might involve going to the doctors together, respectfully encouraging the sick person to follow medical advice. Discussing the problem allows the sick person to highlight their needs and the best ways their spouses can assist them. This happens if the sick person can still process information. And this is why it is necessary for couples to communicate their challenges at the early stage of the illness, or even as they age, when there are no symptoms yet. As we age, we become more vulnerable, and our health can take a sudden turn. As the sick person needs help, caregivers also need help. They should not forget that they need help so as not to burn out. Often, the caregiver becomes so busy and stressed that they neglect their own health needs. Engaging in a hobby or other social activity could be a way to ease the stress and the emotion of watching a loved one degenerating. Knowing your limit can go a long way to help, as well as seeking help and talking about stressful events. Admittedly, some will abandon their loved ones at such a critical time in need. Our conscience should guide us, and we should ask the question, what about if it's me? How would I like to be treated? It could be challenging though, difficult to accept, but the reality is here, and we must not allow such a devastating reality to wreck all our good memories we built when life was fun. Unfortunately, the life that was fun is now showing its other side. It could be tough and even tougher as time goes on, but tough times never last. The sick person has no option. The sickness is chronic. If they can still be motivated, encouraging them to take a step at a time could reduce stress on both sides. With patience and commitment, you and your partner can weather the storm of a chronic illness. Thanks for watching. What are your recommendations for dealing with the strain of a partner having a chronic illness? Share with us in the comment section, please. Your views might help someone out there. Remember to subscribe if you have not done so, and activate the notification bell so you will not miss any of our videos. Until next week, this is Nkoh wishing you the best through life. Cheers and stay blessed. Bye-bye.